Hi, Dr. Diamant. Thank you so much for joining us today. For our ACP Wellness Wave, we greatly appreciate you taking the time to share with us about your experiences and your perspectives on wellness. Can you tell me a little bit about yourself?
Thank you, Victoria. I am privileged to be here with you and to have this opportunity to share some of my experiences. I am an internist at Scripps Clinic. I came to medicine from my undergraduate medical training at the University of Illinois and then to my residency at Scripps Clinic. And I've had a varied career there over the last 25 years. I have a wonderful family. I have an incredibly supportive and amazing wife who is a gastroenterologist. I have two young adult children who are finding their way in graduate school at this time. And I have three dogs that provide a great degree of fulfillment and comfort in my life as well.
That's really wonderful to hear. And thank you so much for sharing. And I'd like to ask, how did you choose your career path in medicine?
So when I came to residency, I was absolutely confident I would be a specialist. My specialty path varied over the course of my training. At the start, I knew I would be a cardiologist. Then I knew I would be a nephrologist. Then I knew I would be a hepatologist. And then I eventually realized there were too many areas of medicine that I really enjoyed that I couldn't focus on one organ. So I decided to become a generalist. So I finished residency being an internist, which back at that time when I finished my training, internal medicine was different. There was no specialty of hospitalism. There was no specialty of geriatrics. So a generalist basically did everything. You took care of your patients in the office, in the hospital, in the nursing home, and also making house calls at that time. My career then diverged in a number of ways. I became very interested in hospitalism once it arose as a specialty and became our first division head of hospital medicine at Scripps. I was also very interested in medical education and became the Internal Medicine Residency Program director, which I did for 20 years. I then diverged into administration and became the executive vice president of Scripps Clinic Medical Group, and found that I couldn't do all those things at the same time. So now I'm a general internist in ambulatory medicine, as well as an executive at our medical group as the vice president. And so my career has taken many twists and turns. Many of them I didn't expect when I started, and it's been a phenomenal career.
Wow, it truly sounds amazing and like an incredible journey. And thank you so much for sharing with us about all of your experiences and how you pursued your passions in medicine. And I'd also like to ask, what advice regarding wellness would you give to current medical students, residents, and trainees?
Now, Victoria, as you know, and as the ACP knows, wellness and burnout are very poignant and hot topics in medicine right now. And that's, of course, because medicine's very hard. Training is hard, practice is hard, and it's demanding upon all of us. And if you look back historically, a generation ago or two generations ago, medicine was different, but it was no less demanding. It's always been hard. It's always been competitive. Yet burnout was not a significant issue when I was finishing my training and for the generation before me. And I think that we have to ask, why is that? And I think that it's related to expectations, and it's related to focus and what has become the focus of medicine. What's not changed is the hard work. What has changed is what I think that we focus upon. I think that it's very easy to get mired in the hard work of what we do. It's very easy to get weighed down by the disappointments that we have. And the disappointments are all around us every day, whether it's answering a question incorrectly, or not obtaining the grade that we wanted, or confronting the angry patient or angry staff member, or whether it's missing the diagnosis that we thought should have been there, or whether it's pursuing or instituting a therapeutic program that wasn't efficacious, or whether it's looking at the mounting paperwork or computer work that is awaiting us at the end of the day. If we focus on those, and we know that we work hard and long hours, of course we are going to burn out. That is the absolute natural history of what should happen with that focus. But for every setback and for every disappointment that we face in medicine, we have far more victories and achievements. And there's something inherent in the nature of those of us that go into medicine to not focus so much on those. We tend to focus more on our insufficiencies than upon our successes or our victories. And whether that victory is learning how to competently perform the neurologic examination, or hearing the splitting of the S2 for the first time, or learning how to read the EKG or chest X-ray or CT scan, or making the correct diagnosis in a patient, or initiating a therapeutic regimen that really benefits them, or having a patient genuinely thank you for what you did for them, or having that patient cry on your shoulder and knowing and realizing that you are the emotional support that that person needed. If we focus on these things that we experience every day or every week at the least, we'll walk out of our offices, we'll walk out of the hospital every day fulfilled and wake up the next morning every day wanting more. But if we focus on the other things, you're right, you won't want to go back to work the next day. So it's very much a matter of focus and priority. Similarly, we have to have appropriate or realistic expectations. I think a lot of us want to excel at many, many things.
The next question would be, how do you combat burnout in medicine?
Yeah, so I think that's really getting at what we spoke about a moment ago, Victoria, and that is setting appropriate expectations both for practice and life, as well as focus in practice or in the work we do. And we will burn out if we focus upon the hard work that we're doing and the disappointments that we face. In practice and life, in education, they're rife with disappointments. They're there if we want to look at them and dwell upon them. I think that we spoke about, whether it's grades or the missed diagnosis or the staying late after work and missing an event with your friends or your family. And we tend to focus upon those and lose sight of the tremendous joy and victory in what we do every day, whether it's accomplishing or developing a new skill, developing a new set of knowledge, of making a bond with a patient, of diagnosing a disease that somebody else didn't diagnose, of finding the therapy that's very effective, whether it's treating a UTI or major depressive disorder or heart failure or pneumonia, is day in and day out, we have diagnostic and therapeutic victories, which sometimes they seem small to us. As the surgeon, he or she removes a cancer or removes diverticulitis, and feels this great victory. And we in medicine, we don't think of ourselves the same way when we treat diabetes or depression or pneumonia or UTI or respiratory failure. Every one of those is as great a therapeutic victory removing a cancer. We change people's lives in amazing ways, both with medications, but also with our bonding and interaction with them. And if we focus upon those, is burnout will recede into the background very rapidly, because work will no longer be a burden. It will become a joy. It will become a thrill. And if you leave work every day thrilled, saying, I did something important today, I made a difference in somebody's life, I removed their pain or their suffering or cured their potentially life-threatening or life-damaging disorder, it's a pretty big high. But you have to focus on that to feel that high and realize that it's there. It's kind of like the runner's high. Is the only runners that experience it are the ones that let it in and that want to feel it. The ones that don't focus on it, they don't enjoy it or experience it. And the same is true in medicine. And like running will stop being a burden when you start enjoying it. Medicine will stop being a burden when you allow yourself to feel the thrill of it every day. And you'll want to come back, maybe not every day, but almost every day if you have the right focus in medicine.
Absolutely. Thank you so much, Dr. Diamant, for sharing your wisdom and your insight on how to maintain, excitement and passion in clinical practice. And I also wanted to ask, would you have a wellness phrase that you could share with us? And would you be able to share a phrase that encompasses what wellness means to you?
To me, a wellness phrase would be what we just spoke of. It's taking in and focusing upon the joy in medicine and the successes that we have in both medicine and in life. And that's really where I put my money in terms of my career and my sense of well-being.
Thank you so much for sharing your insight and your, approach and perspectives in wellness. I think it will touch a lot of people and will resonate with a lot of residents, physicians, medical students, and, even pre-medical students who are, visualizing who they would like to be and who they would like to become. Is there anything else that you would like to share regarding wellness or your journey, or any advice you'd like to provide for future trainees?
I guess that's one thing I'd say about my journey is my journey has been very varied in medicine. And so I would say to everyone is you are not locked into any choice you make, any career path you enter. There will always be opportunities to make changes, to vary it in ways that will be more enriching or fulfilling to you. So never feel like, oh gosh, I picked general internal medicine, or I picked GI, or I picked cardiology. Now I'm not so sure. You can make it into anything you want it to be, whether it's in education or science or program development or administration or practice. You will find the combination that you want, and you will have endless opportunities to morph that career into the career you want it to be.
Thank you so much, Dr. Diamant, for your time today and for taking the time to share with us. And we greatly appreciate you participating in our project and joining for this interview today. Thank you very much.
Thank you, Victoria. Good luck to all of your team and your audience.
Thank you so much, Dr. Diamant. We greatly appreciate it.